Bismillahirrahmanirrahim and good day everyone. I, Dr. Sadia Atta, welcome you all on board. Today the topic of our discussion is Class 1 Malocclusion. At the end of the topic, we shall be able to gain an understanding of the features of a Class 1 Malocclusion, and what are the various etiological factors that are involved in a Class 1 Malocclusion. We'll be studying about the various features of Class 1 Malocclusion. And then we'll talking about the management of the range of problems that can be seen in class 1 malocclusions. Finally, we'll be discussing the extraction guidelines that are for class 1 cases. Before moving into the topic of today's discussion, that is class 1 malocclusion, let me briefly revise skeletal class 1, class 2 and class 3. Here we need to differentiate between the skeletal classes and the classes of malocclusion. So when we call the skeletal class 1, class 2, class 3, we mean that we are talking about the jaws, maxilla and the mandible. As we have studied earlier, that in case of class 1, skeletal class 1, the patient usually presents with a harmonious face, a balanced face, with a straight facial profile. Usually in cases of class 1, both the this is the maxilla, both the maxilla and mandible, they are lying in harmony with each other, which leads to the development of a straight face. When we talk about class 2, skeletal class 2, the patient usually presents with a convex profile. A convex profile is seen in cases of class 2. Why is the presentation of a convex profile is there in cases of class 2? Because either the maxilla itself, this is the maxillary jaw, either the maxilla itself is forward, or the mandible is backward, or either the maxilla is forward and the mandible is backward. So what can happen in cases of skeletal class 2 that are presented with a convex face? That either the maxilla is prognathic or the mandible is retrognathic, or we can see that both the maxilla is prognathic and the mandible is retrognathic. That is leading towards the skeletal class 2. When we talk about skeletal class 3, the patients in cases of skeletal class 3 usually presents with a concave facial profile, in which the mandibular jaw is ahead of the maxillary jaw. It may be because of the retrognathism of the maxilla, that maxilla is short in anteroposterior plane, or it may be because of the prognathism of the mandible, that is mandible is forward or anteriorly placed, or it can be a combination of both, that is it may be because of maxillary retrognathism and mandibular prognathism. So, in skeletal class 1 cases, the patient usually presents with a harmonious face, a balanced face in which there is a harmony in the anteroposterior relationship of the maxilla and the mandible. When we talk about skeletal class 2, we said that the patient presents with a convex facial profile in which the maxilla is lying ahead of the mandible, way ahead of the mandible. Whereas when we talk about the skeletal class 3, we say that the patient presents with a concave profile with mandibular jaw lying ahead of the maxillary jaw. These are the skeletal classification. Now today we will be discussing about the malocclusions. As the word suggests, as the name suggests, malocclusion, that any disharmony or change in the relationship of the dental structure or the occlusion. Therefore, we will not be discussing the skeletal classes, and we'll be discussing the dental classification of occlusion. Therefore, we'll be classifying it class 1, class 2, class 3 on the basis of dentition. That is the difference. That we will be classifying class 1, class 2, class 3 on the basis of the dentition. Now, there are two different school of thoughts according to which the dentition is classified into class 1, class 2 and class 3. One is American based school of thought, that is the idea that is given by the angles, and the second is the British school of thought, in which there is the British incisor classification. British Standard Institute has classified the malocclusion. When we will be going to classify the malocclusions on the basis of angles, angle you use molar as a reference point for the classification of malocclusions. But when we'll be talking about the British Standard Institutes, then British Standard Institute BSI, it took the incisor as the reference for classification of malocclusion. So we'll be studying both of them. According to angle classification system, the major pillar on which the classification of malocclusion is based is the molar. So, according to angle, the normal occlusion is when the mesiobuccal cusp of the upper molar, it is coming in contact with the buccal groove of the lower. This is angles class 1, with all other teeth that are present are lying on the line of occlusion. This is a normal occlusion or a class 1 occlusion according to angles. And then what is a class 1 malocclusion according to angles? According to angles classification, a class 1 malocclusion is when the molar is having a class 1 relationship, that is the mesiobuccal cusp of the upper molar lies in the buccal groove of the lower molar, but the other teeth that are present in the arch, they are not lying in the line of occlusion, and there are abnormal relationship or malpositions of those teeth, that may be crowding, spacing, displacement, or anything. Therefore, according to angle, a class 1 malocclusion is when the molars are lying in the anteroposteriorly, they are lying in a correct relationship, that is the mesiobuccal cusp of the upper molar is lying in the buccal groove of the lower molar, but the other teeth, they are not lying in the line of occlusion, and they are having any disharmony, for example displacement, rotation, crowding, anything, that is class 1 malocclusion. And when we talk about the British Standards Institute classification, the malocclusion is based on the incisor classification, as I have mentioned earlier. Therefore, according to BSI, class 1 malocclusion is dependent on the incisor relationship. Before I tell what class 1 malocclusion is, we need to know that this is the upper incisor. This is the upper incisor and this is the lower incisor. This is the cingulum of the upper incisor and this is the incisal edge. In between the cingulum and the incisal edge is the cingulum plateau. It is known as the cingulum plateau. So, according to BSI, class 1 malocclusion is classified as when the lower incisal edge, this is the lower incisal edge, it occludes with or lie immediately below the cingulum plateau. That is the cingulum plateau, and this is the range where it should be present. If it occludes with or it lie immediately below the cingulum plateau of the upper incisors, then it is classified as class 1. According to BSI, if the lower incisal edge, it is lying immediately below, or it is occluding with the cingulum plateau, we classify it as class 1. And in class 1 malocclusion, there will be disharmony that will be present in the arch, for example rotation, crowding, as I mentioned earlier. So with the class 1 malocclusion, according to either angles or the incisor classification, what is present is the anteroposterior relationship. The anteroposterior relationship of the occlusion, they are lying in the normal range, whereas the discrepancy is present within the arches, as we can see here. It can be the intra-arch discrepancy, for example rotation or crowding, or inter-arch discrepancy. For example, any discrepancy that may be present in the vertical plane or the transverse plane. As we have already studied the malocclusion in the vertical and the transverse plane, that is, for example, in the vertical plane we may see any open bite, we may see any deep bite. Any change in the bite can be seen in the vertical plane or the transverse plane, in which we can experience the cross bites. Till now we have discussed the classification that the incisors can be classified according to the molar, in which the mesiobuccal cusp of the upper molar should be fitting in the buccal groove, or they can be classified according to the incisors. That is, the lower incisal edge should be lying at the or occluding with the cingulum plateau. In both cases, we said that the intro-posterior relationship, occlusal relationship are normal. That is what a class 1 malocclusion is, with a discrepancy that is present within the arches or intra-arch discrepancy. Now I'll be talking about the etiology of class 1 malocclusion. Usually we divide the etiology into three parts, that is the skeletal part, the soft tissue part, and the dental part. And majorly the dental factors are the factors that are involved in the etiology of a class 1 malocclusion, and least likely the factors that are to be involved in the etiology of class 1 malocclusion are the skeletal and the soft tissue factors. So majorly the factors that contribute towards the class 1 malocclusion, they are the dental factors. I'll be discussing them one by one. So when we are talking about the skeletal etiological factors, usually in class 1 malocclusion, the skeletal pattern is class 1, but it can be class 2 or class 3 with the inclination of the incisors compensating for the underlying skeletal discrepancy. So usually the pattern is 1, therefore there is no discrepancy in the skeletal pattern. And in cases of class 1 malocclusion, usually milder form of transverse discrepancy are seen. Not severe form of transverse discrepancies or cross bites are seen. Severe form of transverse discrepancies or the cross bites or the maxillary deficiencies are seen in cases of skeletal class 2 or class 3. But in cases of class 1, the skeletal class 1 or the class 1 malocclusion, as the skeletal pattern usually is class 1, therefore milder transverse discrepancies are often seen. Now, in cases of class 1 malocclusion, there can be increased vertical skeletal proportions or an anterior open bite, or can be decreased vertical skeletal proportions, for example deep bites, that can be seen in cases of class 1 malocclusion. So majorly what we need, we are gonna say, what I need to say here is that the etiology of class 1 malocclusion, skeletal component is not playing a major role. Usually it is a class 1 case with slight amount of vertical or transverse discrepancies that are present. Now when we talk about the soft tissue, in most class 1 cases, the soft tissue environment is favorable, and it is not an etiological factor. But the major exception to this is Bimaxillary Proclination. As we can see here, that the patient is having a harmonious, well-balanced profile with equal ideal proportions. Competent lips means the soft tissue is usually favorable in cases of class 1 malocclusions. The major exception that we are going to talk about is the bimaxillary proclination. And what do we mean by bimaxillary proclination? That both the upper and the lower incisors are proclined. Both the upper and the lower incisors are proclined, but they are meeting at the cingulum plateau. Therefore, according to incisor classification, they comes under class 1 malocclusion. So in cases of bimaxillary proclination, usually it is racial in origin, based on the ethnicity, but it can also occur because of the lack of lip tonicity. That can be a cause of etiology of soft tissue etiology of class 1 malocclusion, the lack of lip tonicity, which basically results in the incisors moving forward under the tongue pressure. Therefore, what happens in class 1 soft tissue etiology is a bimaxillary proclination, in which, under the influence of tongue, the upper and the lower incisors they move forward because of the lack of lip tonicity, and it leads to incompetent lips and convex facial profiles. In cases of bimaxillary proclination, I'll be discussing them in detail with you. So soft tissue majorly is not an etiological factor. Exception to this is a bimaxillary proclination. Now coming to the third etiological factor, that is the dental factor. Now dental factors are the main etiological influences in class 1 malocclusion. So majorly what factors are involved in case of class 1 malocclusion are the dental factors. And among the dental factors, the most common one are the tooth size, arch size discrepancies, which means that the size of the tooth and the arch, they are not lying in harmony with each other, which can either lead to crowding or spacing in the arch. There can be environmental factors, for example, the premature loss of a deciduous tooth, which may lead to the localization of any pre-existing crowding, and possible deviation of the center lines or midline shift can be seen. That means that in cases of dental factors, there can be environmental factors or they can be the local factors. Among the environmental factors, for example, premature loss, which leads to the aggravation of the existing crowding, or the local factors, they may include the displacement of some teeth, or impaction or anomaly that can be present in the size, number, and the form of the teeth. All these factors, they can lead towards the development of a class 1 malocclusion. So till now we have discussed that what is class 1 malocclusion, and we said that it can be classified on the basis of molar or incisors, and the anteroposterior relationship in these type of malocclusions is in harmony. The discrepancy is lying within the arches. And then we talked about the ethological factors, that is the skeletal and the soft tissue and the dental factors, in which we said that majorly the dental factors are the ones that are determining this malocclusion. Among the dental factors, said that they can be the environmental or the local factors, can be localization of the pre-existing crowding or any disharmony that is between the size, shape, and form of teeth, or displacement or impaction. All these factors may lead to the development of a class 1 malocclusion. Therefore, in class 1 malocclusion, what we see is a harmonious relationship of the underlying skeletal structures, that is maxilla and the mandible, and the mal relationship or the malocclusion, it is restricted to the dentition only. For example, the change, the rotations, the crowding, anything that is apparent, it is present in the dentition only, and the underlying skeletal relationship is in harmony with each other. The malocclusions that are present in class 1 cases, they include individual tooth malalignments. By individual tooth malalignments, we mean either there will be rotations, either there will be spacing, or a high up canine, or any tooth that is placed in individually in not in a normal position, that is not lying in a line of occlusion. The malocclusions, they may be present in the vertical or the transverse plane. So vertical malocclusions can be either open bite or deep bite, and the transverse plane, we can usually see either the narrowing of the maxilla, that is transverse maxillary deficiencies, or either we can be seeing the cross bites in cases of transverse plane. And when we talk about the bimaxillary, the exception to it is the bimaxillary proclination. For example, we can see that both the upper and the lower incisors are proclined, They can be seen in cases of class 1 malocclusion, and it is known as the proclination of both the upper and the lower incisors. It is known as bimaxillary proclination. Or we can see commonly, what we can commonly see in cases of class 1 malocclusion is the crowding in the maxillary or the mandibular arch, that is the arch length discrepancies and the crowding that may be present in the maxillary or the mandibular arch, as we can see here. Severe amount of crowding that is present in the lower arch, but the incisors, they are lying in a class 1 relationship. The rotations that are present, the incisor relationship is normal, the molar relationship is normal, but individual tooth malalignments and arch discrepancies are there. So the problems that are associated with class 1 malocclusion, they are dental in nature and are associated with the dentition or the surrounding soft tissue in case of bimaxillary proclination. And the patient usually presents to you with a concern of smile aesthetics. There are no other concerns about the jaws or the facial profile. The main concern of the patient with class 1 malocclusion is the smile aesthetics. As we can see here, the patient is having a straight profile, equal thirds, harmonious face, but the smile is compromised. So usually in cases of class 1 malocclusion, the patient presents with a concern of smile aesthetics and the correction of a smile arc. Now we'll be discussing the features of class 1 malocclusion, in which first we will be discussing the skeletal features and then I'll be talking about the dental features. Usually in case of class 1 malocclusion, the patient presents with a well-balanced face, a harmonious face that is lying in harmony, and usually a straight facial profile is seen with competent lips or incompetent lips. The lips may be competent or incompetent depending upon the amount of proclination that is present in class 1 malocclusion. If it is a bimaxillary proclination, then the profile is not straight. Usually in cases of bimaxillary proclination, the profile the patient presents with is a convex profile. I'll be discussing that later. The lips, as I mentioned earlier, they can be, as we can see here, the lips are competent, but the lips can be competent or incompetent in cases of class 1 malocclusion. The most common forms of of class 1 malocclusion that we can see are either the bimaxillary proclination or crowding. So these are the most common two things that can be seen in cases of class 1 malocclusion. So till now we have discussed that usually the patient will be presenting with a harmonious face, well-balanced face, with maxilla and mandible having a balance in the anteroposterior plane. The problem will be lying in the dentition. The patient can be having competent or incompetent lips based upon the amount of anterior proclination. But when we talk about the variant that is bimaxillary proclination, in that case the patient will be having incompetent lips and a convex profile instead of a straight profile, and most commonly crowding and bimaxillary proclination are seen in cases of class 1 malocclusion. Now moving towards the dental features of class 1 malocclusion, as I say that the incisor relationship is class 1 according to BSI, or we can say that the molar relationship is class 1 according to angles. Therefore, the relationship, either the incisor relationship is class 1 or the molar relationship is class 1, but the teeth, they'll be showing individual tooth malpositions. There'll be malpositions in the individual teeth. We can see here, or we can see rotations, we can see hypodontia, displacements that will be present. And then these individual teeth malpositions, they can be seen with varying degree of severity. So what do we mean by varying degree of severity? For example, if there is a rotation It can be a mild rotation, it can be a moderate rotation, it can be severe rotation. So varying degree of severity of the individual occlusion can be, or malposition can be there, or a displacement. It can be mild displacement, moderate displacement, or severe displacement. Or for example, if we talk about the crowding, in class 1 malocclusion there can be mild crowding, moderate crowding, severe crowding. Therefore, varying degree of severity of the individual malposition or malocclusion can be seen in cases of class 1 malocclusion. Or there can be vertical or transverse plane malocclusions. For example, as I have mentioned earlier, there can be open bites or deep bites or cross bites that can be seen in case of class 1 malocclusion. A lip competency in case of class 1 malocclusion is dependent upon the proclination of the anterior incisors. Particularly in case of bimaxillary proclination, we'll be seeing lip incompetency. Now we'll be discussing the bimaxillary proclination or bimaxillary protrusion. What are the various skeletal features that can be seen in cases of bimaxillary protrusion? Skeletally, we'll be seeing in cases of bimaxillary protrusion that maxilla and mandible, they'll be showing prognathism. That is, the maxillary and the mandibular jaw may be prognathic in cases of bimaxillary protrusion with an increased A and B. By A and B, we mean the angle that is present between the maxilla and the mandible when we are comparing them in the anteroposterior plane. Therefore, anteroposteriorly, the angle between the maxilla or the mandible may be increased. The patient, in case of bimaxillary proclination or prognathism, presents with a convex facial profile, and because of the increased inclination of the incisors, both the upper and the lower incisors are proclined. Because of the increased inclination and lack of lip tonicity, there will be lip incompetency, and because of that lip incompetency, you'll be seeing the everted lips. More everted lips will be seen in cases of bimaxillary protrusion with incompetency. And when the patient he or she tries to bring the lips together, we can see a strain at the mentalis muscle in cases of bimaxillary proclination. Similarly, what can be seen in case of bimaxillary proclination is a steep mandibular plane angle. A steep mandibular plane angle can be seen. Now, talking about the dental features of bimaxillary proclination, both the upper and the lower incisors, they are proclined, as can be seen here. Both the upper and the lower incisors are proclined in cases of bimaxillary proclination. Usually the incisor, canines and the molars, usually they are class 1. But if we are classifying according to molar, then the molars are definitely class 1 or the incisors are definitely class 1. Because of the proclination of the upper and the lower incisors, the interincisal angle, that is the angle between the upper and the lower incisor, it is decreased in cases of bimaxillary proclination. And spacing may be seen. Because of this proclination, spacing may be seen in the arch. And as I have mentioned earlier, when we talk about the radiograph, usually a steep mandibular plane angle is seen. Therefore, in cases of bimaxillary proclination, which we can see is proclined upper incisors, proclined lower incisors, class 1 incisor relationship usually, and decreased in interincisal angle, spacing can be seen. So these are the multiple features that can be seen in cases of bimaxillary proclination. This is all for today. So till now we have discussed the etiological factors, and after the etiological factors we have discussed the various classical features of class 1 malocclusion, in which we said that the patient presents with a harmonious face. Competency or the incompetency of the lips depends upon the incisor position. And then we talked about that the incisor and the molars, usually they are lying in class 1 with the anteroposterior harmony, but the discrepancy and the malocclusions are lying within the arches. Then we talked about the bimaxillary proclination or protrusion, in which we said that the maxilla and mandible, they are not in harmony, they are prognathic. There can be an increased A and B, convex profiles, incompetent lips, everted lips, and steep mandibular plane angle that is seen in cases of bimaxillary proclination. And we talk about the dental features. We said that the interincisal angle will be decreased because of the proclined upper and proclined lower incisors, but they are coming in contact in a class 1 malocclusion. Usually, a space can be seen, and because of this proclination, the incisors will be the incisors will be so much proclined that the lips will be incompetent. This is all for today. In the next lecture, we'll be discussing the treatment and the management of class 1 malocclusion. Till then, stay home, stay safe. Allah Hafiz.